Good day, Congressman. Today we will be discussing your positions on Medicare, what you see as the best plans for the current program and plans for the future program.
Yes, the Medicare program is the topic of much discussion this year. Created in 1965, its mission was to provide health coverage for older Americans. I strongly support Medicare, and it must be preserved, protected and strengthened.
Your plans leave much of Medicare the same as it now is for the current recipients. But I noticed that you would repeal the Independent Payment Advisory Board and provisions to close the Medicare Part D prescription drug coverage gap, the donut hole, by 2020. You voted for the Ryan budget, so you seem to have a very different view of what Medicare will become after 2022.
Over the years, Medicare has been neglected, and now the Congressional Budget Office, as well as the Medicare Board of Trustees, predict it will be effectively bankrupt by 2021, 10 years from now.
Yes, I think that there is general agreement that Medicare cannot continue to absorb a rate of inflation in medical costs that is twice the general rate of inflation. What is your solution to that problem?
As you mentioned, the budget proposal, drafted by Paul Ryan, entitled The Path to Prosperity, Restoring America's Promise, and passed by the House of Representatives in 2011 with my vote, is projected to achieve a federal budget surplus by 2040. The Ryan budget plan would substantially reduce federal spending on major health programs, including Medicare, Medicaid, the Children's Health Insurance Program. Medicare spending now represents 15% of the federal budget, so reducing federal Medicare spending is a key component of this proposal. The proposal would reduce the growth in Medicare spending by capping the growth in expenditures per enrollee. This means converting Medicare from a defined benefit plan to a system of defined premium support payments. Also, the age of Medicare eligibility would gradually rise from 65 to 67, beginning in 2022.
So under your plan, Medicare would move away from being a fee-for-service program.
Beginning in 2022, all newly eligible Medicare beneficiaries, individuals turning 65 as well as younger, disabled individuals becoming eligible for Medicare, would only have access to health coverage through private insurance plans. They would no longer be able to enroll in traditional Medicare. Under the new premium support system, Medicare beneficiaries would be entitled to a payment from the federal government to help defray premiums and other health care costs under the plan. The government would make payments directly to private health plans on behalf of Medicare-eligible enrollees. This would be instead of paying hospitals, physicians, and other medical providers directly for the services provided to their Medicare-eligible patients, as happens currently.
Can you describe what happens if the government payments to plans on behalf of enrollees do not cover premiums and or other costs?
If the government payments to plans on behalf of enrollees were insufficient to cover premiums and or other costs, beneficiaries would be responsible for the additional costs. In other words, Medicare would no longer provide coverage for medical care, but instead would provide a subsidy toward the purchase of a private health insurance plan.
It seems clear that the revisions to Medicare starting in 2022 will put a cap on the cost of Medicare for the government, but what will these changes mean for the recipients?
Under the premium support system, beneficiaries could choose among competing private plans offered in their area through a new Medicare exchange. Plans offered through the Medicare exchange would be required to enroll any Medicare beneficiary who wishes to enroll, without regard to health status or income. The proposal would require private plans in the new Medicare exchanges to comply with a standard for benefits that would be approved by the Office of Personnel Management, which oversees the benefits for the federal employees' health benefits program.
But the benefits that are specified by the Federal Employee Health Benefit Program for the premium support version of Medicare, I'll call it premium support care, would not necessarily be and would very likely not be the same benefits that the federal government employees now enjoy under the Federal Employees Health Care Plan. In other words, just because the premium support care plan is approved by the same agency that approves Congress's health care plan does not mean it is the same plan. Correct?
That is correct. The plans are different, but using the Federal Employee Benefits Program as the agency that specifies the benefits for the premium support plan will allow us to point to some standard of care, even though Congress can change it from year to year.
Won't the different exchanges offer different plans under the new program? with different benefits. This approach differs from the current Medicare plan, which entitles beneficiaries to a defined set of benefits.
An advantage of offering a number of different plans in the exchange is that different plans can offer different benefits at different costs and can compete on the basis of price and quality.
What are the projected cost differences to an individual in 2022 under the Premium Support Care Plan versus traditional Medicare?
Beneficiaries enrolled in private plans would be expected to pay premiums and other costs over and above the federal premium support payment made to the plan on behalf of the enrollee. The General Accounting Office projects the average annual premium cost for a 65-year-old in 2022 to be $20,500 in a private health care plan. The government would contribute $8,000 or 39% toward the total cost. The remaining $12,500 would be paid by the beneficiary. The Congressional Budget Office projects that out-of-pocket costs for the typical 65-year-old would be more than twice as large under the proposal than under traditional Medicare in 2022. This is because the cost of providing benefits is greater under private plans than under traditional Medicare.
But a typical 65-year-old in 2022 who retires with average earnings will be eligible for $25,560 in Social Security retirement benefits. Under the Premium Support Care Plan, the $12,500 that the retiree will be expected to pay for the insurance premium will be close to half of their total Social Security income. Is it realistic to expect retirees to pay this much in premiums?
Under the Premium Support Care Plan, insurers will compete for enrollees. The plans will give beneficiaries greater incentive and ability to choose a plan that best meets their needs. Giving beneficiaries more skin in the game will exert more pressure on plans to reduce costs.
That seems like a lot of skin to put in the game. What if those 65 and older just cannot afford those premiums?
I am sure that by reducing the benefits we can make retirement insurance affordable to all.
You have complained that the new law, the Affordable Health Care Act, establishes an independent payment advisory board which will have the power to ration health care. If retirees can't afford premiums under the Premium Support Care Plan, isn't that rationing?
The ability to choose medical coverage that you can afford is the right kind of rationing, the rationing of the marketplace. We have experience with that every day. Not everyone can afford everything.
That is quite a change. You have said that you think it should be left to patients and their physicians to determine what care is to be provided and how to pay for it. Under current Medicare this is the case. However, under the Premium Support Care Plan, won't there be so much pressure to keep costs within a range that the average enrollee can afford, that what will result will be a strong version of managed care, where any relationship between a patient and their current doctor will be severed for good?
I am not too concerned about that. Those were just talking points that I was given to use against Obamacare, anyway.
Thank you for your time, Congressman.